In November of last year, the Biden administration proposed expanding Medicare and Medicaid coverage for GLP-1 medications. Cited evidence that these drugs can lower blood pressure, improve cholesterol, reduce heart attacks and stroke, and prevent diabetes, with the goal of reducing chronic disease and in turn reducing long-term healthcare costs. Last week, the Trump administration rejected the proposal, calling it too expensive. In response, Dr. Mark Hyman posted this, where he said that canceling Medicare coverage for GLP-1s is exactly the right move and long overdue. First, GLP-1s were never actually covered by Medicare for weight loss. It was just proposed in November and never was enacted. So calling it long overdue is some intentionally misleading rhetoric. Second, he says we should never put meds in front of real food, movement, and sleep, but that's a false dichotomy. We can support access to effective medication and healthy food. The idea that we have to choose one over the other is a distraction from what real comprehensive care can look like. And also, he's relying on you to not know that Medicare already covers several different lifestyle interventions. Behavioral therapy, medical nutrition therapy, and the diabetes prevention program, which includes diet and lifestyle modification and started being covered after a landmark study that's been collecting long-term data for the last 30 years on diabetes and Alzheimer's outcomes until the Trump administration cut its funding last month. GLP-1s don't replace these offerings, they can be used with them in a full spectrum model of care. There's a lot more I could say, especially about the root cause comment, but here's what really matters about this post. Dr. Mark Hyman makes a lot of money in the wellness industry. In 2023 alone, his supplement and other wellness companies brought in over $28 million. On his website, where he sells hundreds of supplements, he has a weight and metabolism section where he sells dozens of products, including a $75 anti-craving supplement called Crave Arrest, and a $73 supplement called Endo Trim, which says it's for anyone looking to improve their body composition. I imagine that GLP-1 medications aren't great for the Crave Arrest and Endo Trim supplement business. So when he says weight loss drugs shouldn't come before whole food, movement, and sleep, the question is, why does he think that his unproven, unregulated, large markup, where the influencer usually makes like 50% commission on the supplement, are exempt from that same critique? He's not against profit. He's not even against biochemical intervention. It appears he's just against FDA-regulated pharmaceutical medications that he doesn't personally profit from. But that's not a principled stance or a public health stance. That's a business model. We need to recognize that for what it is, because while wellness influencers love to rally against big pharma, they're quietly building their own big wellness empires.